Angie, thank you so much for that introduction. And thank you so much to everyone else for your attendance today. Today, we will be discussing an interesting topic, the gut microbiome and chronic disease. The title is An Ounce of Prevention is Worth a Pound of Cure, Chronic Disease and the Gut Microbiome. Let's begin. So we're going to begin today with a question, and that question is, what is the percentage of national health care that is spent on chronic disease and mental health? So actually mental health, especially depression, is considered a chronic illness, so that is included in there as well. So the choices are 20%, 50%, 75%, or 90%. So recall, our topic today is chronic illness, chronic disease. What percentage of the national health care is spent on this? Any guesses? I will check real quick and see if I can see any guesses. Okay, so the answer is 90%. So of all the money spent on healthcare, 90% of that is to address chronic disease. So this is a significant finding with regards to how we spend our healthcare dollars. So really 90% of all healthcare dollars go to address chronic disease. And this is very important for your practice, for your individual patients, for your family members, because this is the bulk of, money going to chronic disease. So this is the bulk of what we're spending our time and efforts on with regards to health. And the great thing is that actually the chronic diseases are generally classified as lifestyle diseases and they are preventable. So we're going to learn how the microbiome is associated with the most common chronic diseases. All right. So today we're going to talk about the most prevalent chronic diseases. Cardiovascular disease is one. This is actually the leading cause of death worldwide. Cancer is increasing in prevalence as well. Type 2 diabetes, we're going to talk about today, and that's connected to the next one, obesity. So we're thinking about that metabolic component. And although historically diabetes and obesity, type 2 diabetes and obesity was considered a illness of the Western world, of North America, United States, we're really seeing this exported across the globe as food habits change. So in North America and Mexico, we see similar incidences of cardiovascular disease, obesity, type 2 diabetes. We're seeing this in India as they really adopt the the westernized food. Obesity is increasing in adults and also pediatric populations. So we want to think about the microbiome in relationship here. Arthritis is actually one of the most common chronic diseases, Alzheimer's disease, and then depression. Now, all of these diseases are fairly complex. Generally speaking, there is no one-size-fits-all treatment. And so understanding how the microbiome relates to these is really going to help our patients, okay? All right, so the microbiome. We're going to talk about the microbiome today, and we're going to think about that old adage from Hippocrates that he said, all disease begins in the gut, right? And that's really because the gut is the foundation of health. Really, it's quite simple process, although it's also fairly complex at the same time. Essentially, the food that we eat feeds the bacteria in our colon, and then the bacteria in our colon ferment these food items to secrete microbial metabolites such as short-chain fatty acids. And those short-chain fatty acids will travel, generally speaking, via the vagus nerve to systemic physiology to influence things like neurotransmitters, hormonal status, blood pressure. So a variety of systemic physiologic functions can be directly related to the gut. I like to think of this, what happens in vagus, what happens in the gut doesn't stay in the gut. So, and that's because the vagus, what happens in Vegas stays in Vegas does not apply to the gut because the vagus nerve. So what happens in the gut does not stay in the gut. So there is an intricate connection there. between the microbiome composition and systemic physiology. So it really is that foundation there. All right. Now, with regards to the gut microbiome, a key terminology that I'd like you to take home today is microbiome abundance and diversity. And you would be hard pressed to review the literature and find any study with regarding the microbiome that does not mention abundance and diversity in relation to physiology and health outcomes, because abundance and diversity is telling us really the makeup of the microbiome. And again, this is the foundation for health. So abundance means how much the quantity of bacteria are in the colon. When there is decreasing abundance, we see issues in the colon. As there's less beneficial bacteria, this leaves room for dysbiotic bacteria. This leaves room for dysbiosis. And this can affect a variety of functions, not only within the colon, but with regards to systemic physiology, because as there's lower beneficial bacteria, then there's lower metabolites like short chain fatty acids to influence colonic health, and then also influence systemic physiology. So abundance is key. The next consideration is diversity, and this means the variety of the microbiome. So I like to think of the microbiome similar to a rainforest, because there's so many different bacteria in there. And if you went to a rainforest and you saw a beautiful variety of plants and animals, that would be pleasing and that would be healthy. But if you went to a rainforest and you saw maybe 2 or 3 different trees, less than 5 different animals, that would be a very unhealthy forest. And it's the same thing with the microbiome. So you want diversity, you want a variety of bacteria within the colon. Now, this is important because the bacteria work together, so they work synergistically together. And having a great variety is associated with positive health outcomes across the board. Interestingly enough, colic in infancy, which is generally very difficult to treat, very difficult for the infant and the parent, is actually associated with decreasing microbiome diversity. So that's one example there. Now, on this graph here, we can see the bacteria by phyla, and the phyla are the different families within the microbiome, and this gives us a great example of abundance and diversity. So the main phyla is going to be Firmicutes, and then after that we have the Bacteroidetes, then the Proteobacteria, the Vermimicroba, the Actinobacteria, and a small group of others. So really having this appropriate balance of abundance and diversity is foundational to human health, not only within the colon, but with regards to systemic physiology. Now there are going to be some keystone bacteria that we're going to talk about. So we'll talk about those in vogue bacteria, the Faecalibacterium protenitzii, and the Akkermansia eosinophila. We're also going to touch upon Lactobacillus, which has been fairly popular for quite some time now. Okay. So let's take a look here at our first chronic illness, cardiovascular disease in the gut microbiome. And like I said, cardiovascular disease is the leading cause of death worldwide. It's associated with 360,000 deaths in 2019, and over 18 million adults aged 20 and older have coronary heart disease. Now, we do know that there's a nutritional component here, right, with regards to cardiovascular disease. A common recommendation is going to be the Mediterranean diet. We're always looking at different research with regards to specific dietary considerations, such as fats, meats, charred meats, things like that. So this is something that's really integral to the understanding of the pathogenesis of this disease. Now, we do know that microbiome dysbiosis has been implicated in the pathogenesis of cardiovascular disease, atherosclerosis, hypertension, and heart failure. And again, the underlying consideration is that there will be an alteration in diversity in the composition of the gut microbiome. Then the next step is going to be the associated metabolites. And then those associated metabolites would implicate systemic physiology such as atherosclerosis, abdominal aortic aneurysms, a stroke, things like that. So that is the theory, and that's what we know now. But the exact mechanism is in terms of saying, we're going to influence this bacteria and it's going to have this end result. It's not there yet. So it's a very intricate system. And we'll go with what information we have now so we can best help our patients. But we're not going to say directly deduce that XYZ bacteria is associated with this outcome, example, hypertension, heart failure, et cetera. The research is just not there yet. So again, the microbiome is extremely complex. So with regards to the latest research about cardiovascular disease and the gut microbiome, there are some metabolites that we do note. So the most basic is going to be short chain fatty acids, and you'll see short chain fatty acids on the test later. This is generally, you can measure these within the fecal sample to understand what's happening in the colon. Additional considerations are going to be bile acid and a specific metabolite associated with inflammation, trimethylamine N oxide, okay? So let's take a look here. And here we have a graphic just to take a look at some of the end products that are associated with these microbial metabolites. So examples, stroke is associated with decreasing fecal butyrate and increased trimethylamine N oxide. So that trimethylamine N oxide is associated not only with stroke, but associated with carotid artery dissection, and then peripheral artery disease. It also associated with kidney, chronic kidney disease and inflammation. Carotid artery stenosis is associated with the decreasing in those short chain fatty acid producing bacteria, which we'll talk about later. And then mesenteric ischemia is also associated with a decrease in the short chain fatty acid producing bacteria, which is associated with that abdominal aortic aneurysm. So we can really see here how these microbial metabolites are associated with these end stage findings of cardiovascular disease. Again, so really we see this connection between the gut microbiome and cardiovascular disease here. The next consideration is cancer. Unfortunately, over 1.6 million Americans are diagnosed with cancer. And really, the American Cancer Fund recommends disease prevention and early detection. That's extremely important with regards to this chronic disease. So we're going to talk about the microbiome and cancer. And now there's a few considerations here. Again, very complex. But when we're thinking about this, we want to think about the immune response. And that's really where the connection is here, in that the microbiome plays a significant role with regards to the host immune response. And where research is really showing us now is that the microbiome can modulate the host immune response, which can be implicated in cancer therapeutics. And so that's really where the research is now. And so with regards to different cancer treatments, what we're noticing is that the microbiome does play a role in efficacy of the treatment. And so there are some instances in trials in which patients are given a fecal microbial transplant and monitored the response to cancer treatments, and those that have a diverse microbiome are doing better than those that don't. Another consideration is the Bacteroides fragilis is emerging as a key component here, and the bifidobacterium. So in a mouse model, recall this is a mouse model, but in a mouse model, the microbiomes that had elevated Bacteroides species as a whole did well response to therapy, and then the mice that had been given antibiotics had a poor response to therapy. So there is a connection here, and research will be ongoing with this, and I think that we're going to be able to help our patients in this way, in the near future. Okay. All right. Now, the next consideration is diabetes, and diabetes is very common. According to the CDC, over 34 million Americans have diabetes, yet over almost 80 million Americans have have prediabetes, which can lead to type 2 diabetes. So there's a large percentage of the US population that is trending toward diabetes. And so this is really where we want to intervene. Again, diabetes is largely considered a lifestyle disease, which has a large nutritional component and is associated with weight management. So obesity we'll talk about as well. And then, generally considered amongst the preventable diseases, right? So potentially we can utilize the microbiome here. Now we're going to talk about type 2 diabetes, but there is a consideration with type 1 diabetes that this increased after World War II, and this is potentially connected to the changes in diet and lifestyle after World War II, where there was a shift from more homemade foods to the more packaged foods and things of that nature. In this case, there is a hypothesis that that disruption in the microbiome did influence this pathogenesis, okay? Now, with regards to diabetes, we're thinking about metabolic syndrome as well for our patients. And here, again, we're talking about a lifestyle disease that can be associated with the gut microbiome. All right, so obesity, here we have obesity. Now, obesity is definitely a consideration with regards to the microbiome. So in the US, this is 1/3 of adults and 1/5 of children. And these rates are just skyrocketing. This is pre-pandemic numbers. Unfortunately, after the pandemic, this is probably increased as well because people did tend to put on weight during that time period. And generally speaking, for adults, there's that creep of a few pounds every single year with age, and that's generally not reversed, right? So we seek a little bit of an impetus here to spur even more contributions to this obesity epidemic. And then we see with school-age children, there was a significant decrease in activity and things like that. So that does make a difference. According to Harvard T.H. Chan School of Public Health, preventative strategies for obesity include physical activity, diet, decreasing screen time, sleep patterns, and stress management. So with regard to these strategies, diet is directly associated with the microbiome because remember, largely the microbiome is dependent on the diet, the food that we feed them. And it's really our responsibility to feed our microbiome the proper food to influence that abundance and diversity. Screen time and physical activity, less related to the microbiome unless you want to get into some considerations with, neurotransmitters and dopaminergic pathways and addiction to, screens, things like that. That would be another thing. But actually sleep physiology is associated to the microbiome. So again, abundance and diversity is really underlying that there. So there is that connection with sleep physiology. So that's, quality of sleep, length of sleep is associated with the microbiome. And stress management. So stress is associated with obesity, as we'll see later. We want to think about our stressed and obese patients holistically. So we want to think about stress. We want to think about cortisol. We want to think about microbiome, hormones, thyroid, all of that under an umbrella. Now, we do know that stress significantly influences the microbiome and is associated with dysbiosis. So stress, when a patient's stressed, this decreases lactobacillus, bifidobacterium, and enterococcus specifically. So bacteria in our colon are, they're prone to, they're fragile. So the bacteria in our colon, they are not made for chronic stress. And under conditions of chronic stress, they will be influenced. The other consideration here is fecal secretory IgA. So that immune function within the colon, that is going to be decreased as well. So then we're going to talk about systemic inflammation as well. So that plays a role here. So diet, gut microbiota, and then with regards to dysbiosis, we're thinking about that. There's going to be permutations in regards to absorption of nutrients. And so these things all go together. It's really a consort. Now, interestingly enough, one of the most popular considerations about obesity in the gut microbiome is that Bacteroides firmicutes balance. Although it's not consistent. And so this does play a role, but maybe not so much as we originally thought. And as we'll see later, there are specific bacteria that do play a role, such as these bacteria associated with inflammation will be higher versus the bacteria associated with butyrate will be lower, things like that. Okay. Now, some of the bacteria also that have been identified are the Clostridium inocuum, the Bacterium dilicum, the Cantibacterium mitsokai, the Lactobacillus ruttii, the Lactobacillus sacchi, and the Actinobacteria. So, these are obesity-related bacteria that we have as well. So we're moving beyond that Firmicutes bacteroides balance and moving into a greater understanding. Microbiome abundance and diversity are key. Of course, we're going to see that as a thread throughout. And the other consideration is the microbiome, can change your food preferences, right? So depending on what makeup of microbiota you have in your colon, that might influence your food choices. Additionally, considerations are going to be yeast, parasites. We're talking about gluteomorphins, caseomorphins, those things do make a difference. So a promising treatment here is actually fecal microbial transplants. And although we might think this is new, actually dates back to 4th century. There are some indications in Chinese medicine. There are some records of what's called yellow soup. Yes, yellow soup. And actually what this is fermented food. It's fermented fecal contents that would be utilized as a treatment for diarrhea, constipation, and fever. So fecal microbial transplants might date back all the way to 4th century BCE in Chinese medicine. Today, we're doing it a little bit differently, and there are some promising studies where fecal transplants are taken from lean individuals, and recipients, donors of obesity do take on a lean body physiology after this. So there is some promising evidence that fecal microbial transplants from obese individuals to lean donors does provide efficacy treatment. So that's a huge understanding with regards to the microbiome is really implicated in this pathophysiology. Now, interestingly enough, I did read an article about fecal microbial transplant recently, in that it's hypothesized that as a young, healthy adult, like in your 20s, you should actually collect your fecal microbiome and store it to be used later in life in your 50s or 60s to transplant it for the health benefits, right? And that we could really see that addressing, the chronic disease that advances later in life, obesity that advances later in life. And so the idea is that your fecal microbiome collected early in life could be used as health benefits and anti-aging benefits later in life. So interesting theory. We're not there yet, but I really do believe this, the clinical use of the gut microbiome in this regard, we're going to see it more and more in the future. Okay, arthritis is the next consideration. Arthritis is a chronic illness, and this has been associated with a reduction of Bifidobacterium and Bacteroides and an increase in the Prevotella species. And another finding we have here is about a germ-free animal model in which arthritis was not developed. And that is one of the ways that we learn about the implication of the microbiome with regards to host physiology is going to be considering germ-free animals. Because if we note in a germ-free model, the pathophysiology, that lets us know that, the gut microbiome does play a role. So in a germ-free model, there was no arthritis developed. With regards to arthritis, we do want to think about diet and inflammatory influences. This is also a possible autoimmune consideration. So intestinal permeability will be very important here. And with regards to intestinal permeability, microbiome dysbiosis does play a role because there are specific bacteria within the colon that are associated with that mucosal barrier. And when that mucosal barrier decreases, that could lead to intestinal permeability. So again, another gut connection here. And then interestingly enough, some of the medications used to treat rheumatoid arthritis have antimicrobial effects. And in patients, there was improvement in the arthritic symptoms and also the GI symptoms. So there is a connection there for sure. Alzheimer's disease. So Alzheimer's disease is amongst the most common causes of mortality in the United States. Currently, there's no established way to prevent Alzheimer's. We do think that this is actually linked to the gut microflora because there's that connection between the gut and the brain, which we're learning more and more about really, but considering that the gut and the brain are so connected, it does make sense to look at the microbiome with regards to Alzheimer's disease. This is strongly linked to depression, which we will talk about. Consider that the chronic diseases can be linked to depression in general. So the diagnosis of a chronic disease and depression do go together, just of note. Again, the microflora can act as a second brain, and the gut microbiome can influence neurotransmitters, neuromodulators, serotonin, kynurenine, catecholamines, and amyloids. So the new research shows that those amyloid plaques are not necessarily the cause of Alzheimer's disease, but these are a consequence of Alzheimer's disease. So that's a consideration there. So it has strongly been postulated that Alzheimer's disease may begin in the gut and is closely related to the imbalance of the gut microbiome. All right. And then our last disease, chronic disease here we're going to talk about is depression. Depression, extremely common. About 7% of the US has reported depression. And this is definitely increasing after the pandemic. Complex, difficult to treat. This touches most people, most families, and now we see children. So more commonly in children, pediatric populations. So with regards to depression and the gut microbiome, we want to think about the vagus nerve again. Remember, what stays in the gut, what happens in the gut does not stay in the gut. Now, serotonin, we know that 95% of serotonin is actually made in the gut. It doesn't travel directly to the brain, but we do have the microbial mediators that travel via the vagus nerve to the brain, and they do stimulate serotonin in the brain. Now, the serotonin hypothesis has come under some scrutiny recently, and that's beyond what we can talk about here. But we do know there is a strong association with microbiome health and mental health well-being. And we do know when we look at the microbiome of individuals diagnosed with major depressive disorder, we see an increase in the Faecalibacterium and the decrease in the Faecalibacterium proteinsii. And the Faecalibacterium proteinsii is, as we'll see, this is a keystone bacteria within the colon, and it is associated with decreasing inflammation. So again, there might be an inflammatory component here as well. There's a whole theory about depression as an inflammatory disease. So, and then in that case, we don't negate the microbiome with regards to its role of inflammation and immune function. So it's still kind of, it all goes together with regards to the gut microbiome is playing a role with regards to immunity, inflammation, these specific bacteria, neurotransmitters, and positive well-being, overall well-being, okay? And recall, depression might be a consideration with any of the other chronic diseases because a patient that's diagnosed with any chronic disease could also develop depression. Okay. All right, so gut microbiome health. Here's a quick Cliff Notes version. So with regards to the gut microbiome, diet is key. So the bacteria living in our colon are dependent on what we feed them. It's really this commensal relationship with regards to the bacteria within our colon and host physiology. So we work together. Specific nutrients that we will talk about do very well to support the gut microbiome. So we're going to talk about specific nutrients such as soluble fiber, polyphenols, those sorts of things really support the bacteria within our colon. And it's really important to assess and address. This is where comprehensive GI testing really comes into play. So we want to take a look at that microbiome abundance and diversity. And we want to take a look at the microbiome as a whole. So additional considerations are going to be intestinal permeability, because recall, some chronic health conditions are associated with intestinal permeability, actually. And there's additional considerations here with persistent viral infections, things of that nature. So we really do actually need to consider intestinal permeability, especially in patients that are presenting with dysbiosis or patients that are maybe consuming gluten, things like that. The next consideration is going to be pathogenic bacteria, because when we're talking about microbiome health, we always want to rule that out, of course, along with parasites, and we want to think about yeast. And another consideration is the parasympathetic nervous system, because recall, the parasympathetic nervous system and the sympathetic nervous system operate individually. So if your patient's in fight or flight, then they're not activating that parasympathetic nervous system. So they're not activating their enzymes, they're not activating peristalsis. So it's very important to actually consider parasympathetic nervous system activation with regards to gut microbiome health. And we see this more and more with these approaches actually to address vagal tone even. So not only thinking about the microbiome, but thinking about that vagal highway to influence systemic physiology as well. So all that's really important. People nowadays are really in fight and flight. That brings me to the next point here. This should actually say eating hygiene. So food hygiene is a different topic with regards to temperature of food and food handling and food prep. That's not this. This is eating hygiene. So eating hygiene is actually very basic, but generally speaking, your patient population might not be engaging in eating hygiene activities. So eating hygiene activities are going to be sit down, chew your food, smell your food, because remember, back in the day when people used to cook food, you would smell the food as it's cooking, and that actually stimulates the digestive enzymes. Nowadays, people are just going through drive-throughs. We're eating on the run. We're grabbing something out of the microwave and then just running out the house with it. Really, that does not stimulate enzymes. And then what's going to happen is that whole digestive process is going to be compromised. So it's very important that you have patients eat when they're relaxed, sit down, chew your food, because that stimulates enzymes. And then that's going to help with the breakdown of the food. And then that's going to help provide the substrates to feed the microbiome to influence systemic physiology via the appropriate metabolites. Sometimes people have an immaculate diet, but they actually just have no elastase, they have no HCl because they're not relaxed when they eat. And this is a condition that we see with this American lifestyle, with the busy life. And this is going to be adults and children. So this is a consideration, eating hygiene for sure. All right, so with regards to the microbiome, today we're going to talk about a healthy gut, because we have established that really the microbiome does play a role in chronic disease. So what are we going to look for? We're going to look for balance. Again, balance is so important, cannot be underestimated, abundance and diversity. Like I said, with every single study that I have seen with regards to the microbiome and physiology, abundance and diversity is mentioned. So really, when you're evaluating this for your patients, this is really doing them a good service. Of course, we're going to identify the presence of pathogenic viruses, bacteria, and parasites, because those need to be addressed predominantly. So we're going to triage that, right? Yeast is going to play a role as well, especially if your patient has yeast overgrowth. They are going to be craving sugar and things like that. And we know that sugar is inflammatory. It can definitely contribute to some of these conditions, especially obesity, cardiovascular disease, et cetera. So we want to look at this. Fecal secretory IgA is very important, that immune function in the colon, because this is really where the outside world meets your physiology, is right in the colon there. So that immune function in the colon is very important. This is intricately related to microbiome abundance and diversity. So if there's any dysbiosis, fecal secretory IgA could be compromised. This is also associated to chronic stress. So during actually acute stress, fecal secretory IgA increases as the body could be prepared to fend off foreign invaders. But then during chronic stress, it actually decreases, because the body's not made to be in chronic stress like our modern life induces. So fecal secretory IgA is a very important marker. Additional considerations are inflammatory markers, so lysozyme, calprotectin, lactoferrin. and very important as well. And then short chain fatty acids. As we saw, short chain fatty acids are those microbial mediators and especially implicated with regards to the pathogenesis of cardiovascular disease. So now we're going to talk about some rock stars, some in vogue bacteria right now. Actually, keystone bacteria would be the name. So the first one is the Faecalibacterium protenitzii. This is very important to identify with regards to any stool sample. So this is the most abundant butyrate producing bacteria in a healthy GI tract. Faecalibacterium protenitzii is extremely anti-inflammatory because it is responsible for that large amount of butyrate production. And this also provides protection for the mucosal barrier. The mucosal barrier within the human colon is very important. And the mucosal barrier is really involved in, again, protecting the luminal contents from systemic physiology, allowing our immune system to actually sample the luminal contents and see if it needs to mount an immune response, things like that. The body actually makes 1.5 liters of this mucosal barrier every single day. So the body puts a lot of effort into this healthy mucosal barrier. So the bacteria involved in mucosal barrier integrity are going to be of significance. So yeah, Faecalibacterium protenitzii, anti-inflammatory, associated with butyrates. So of note, with regards to Faecalibacterium, it is decreased in inflammatory conditions like inflammatory bowel disease, also celiac and irritable bowel disease. And it's also decreased in patients diagnosed with bipolar disorder, Parkinson's, colorectal cancer, and then for the chronic conditions, it's going to be cancer and diabetes. And diminished levels of eppregnancy were found in patients with major depressive disorder. So again, recall the microbiome, this is not a cause and effect relationship at this point. That's not what we're saying here. We're saying that this bacterium has been noted to be lower in the patients diagnosed with these conditions. And so our part, is to look at all of this information that we have for our patients and see if we can support them, essentially. Okay. The next one is Akkermansia muciniphila. This is the mucus-loving bacteria. Akkermansia is a specialized bacterium that actually produces that mucus layer in the colon. And most people are familiar with this now because it's really becoming popular in clinical circles. And the Akkermansia is very important in that it does contribute to that mucosal barrier. But when it's actually too high, most people don't know this, but when it's too high, it actually eats the mucosal barrier as its food source. And that decreasing mucosal barrier can lead to intestinal permeability. So this is one to get a level on. Decreased levels have been found in patients with diabetes, obesity, and IBD. And actually of note, patients that have lost significant weight have higher Akkermansia. So it may play a role in proper weight reduction. And this is one that has known to have been decreased in patients following a low FODMAP diet. So if you have patients on a low FODMAP diet, I would evaluate this as well. And again, intestinal permeability. So this is a clue with regards to intestinal permeability, and in patients diagnosed with intestinal permeability, it would be prudent to understand the value here. All right. And then another important bacterium is the Faecalibacterium genus. This species is associated with short-chain fatty acids, specifically acetate and propionate. So we want to think about the microbiome, and then we want to think about these metabolites, the short-chain fatty acids, and their balances. This one is specifically associated with the mental state and metabolic effects in the human. So it's actually increased in patients diagnosed with major depressive disorder. And then with regards to another chronic disease, it's decreased in patients diagnosed with Alzheimer's disorder. Also decrease in ulcerative colitis and Crohn's. This species loves cruciferous vegetables such as broccoli. So that's an interesting thing, that when we do know the food preference of the bacterium, their nutrient source, we can actually consume that to influence the microbiome. So again, we're really seeing a link here between diet, microbiome, and systemic physiology. Okay, so let's get into the nitty and gritty of some excellent testing here. So GI 360. Now GI 360 is great because it kind of takes all the information about the microbiome and puts it onto a nice, beautiful, clinically applicable test for your patient. The first thing we see on the GI 360 is the web, and the web is a visual representation of abundance and diversity organized by phyla. So here we have the actinobacteria, the vermimicroba, Trinicules, proteobacteria, Firmicutes, and Bacteroides represented in a web. And your patient's result is that white web there, and it's superimposed on the normobiotic reference range, which is the green hexagon. And patients love this graphic because they can see their results as, where it falls on the norm. And this we see here is making like a squished hexagon. So we're thinking there's lower abundance, right? Because it's smaller and there's a slight disruption with diversity because it's not making a hexagon. So this is an excellent tool for your patient. The next pieces of information we have are two indices. One indices is the dysbiosis index, and the second one is the diversity score. So recall, dysbiosis, we're thinking about the balance of the bacteria and their influence over the colon. So dysbiosis is not healthy. Scores go from 1 to 5. So 1 and 2 are healthy normobiotic guts, meaning no dysbiosis. 3 is moderate, and then 4 and 5 are dysbiotic guts. With diversity, it's the exact opposite. Remember the forest analogy? We want a diverse microbiome. We want a lot of different bacterium. So with diversity, 1 and 2 is actually considered less desirable. 3 is moderate, and then 4 and 5 are healthy, diverse microbiomes. And here we see another example of the GI 360, and we'll go through this with a case, but all of the information will be listed line by line, the 45 different species that are computed to create that diversity index and the dysbiosis score. And then additionally, all that information is put together in the web. So the web and the scores are great information to show your patients, and you can have clinically actionable results. Yet at the same time, you can really get into the nitty gritty, and you can see for this patient, we have fecal bacterium praenicii is lower, so we'd expect butyrate to be low at this point, and if not now, potentially in the future, and those are the type of considerations that we can see here. All right, so let's take a look at some cases. All right, so our first case is a previously overweight individual who has been depressed for his entire adulthood, and he's actually in the care of a psychiatrist. So this is excellent. The psychiatrist is noting this connection between the microbiome and mental health status, particularly depression. Within the last 3 months, this patient decided to really take his weight and depression into his mental health into his own hands and switch to a less processed food diet, lost 20 pounds, although in that same period was on 3 rounds of antibiotics for H. pylori. Okay. So here we see this individual's web. Recall that web is the patient's results superimposed on the normobiotic reference range. So this is dysbiotic, right? So we see moderate dysbiosis because it's close to that hexagon, but it's not exactly there. Then we will look at the scores. The dysbiosis index score, recall 1 and 2 are healthy, 3 is moderate, and 4 and 5 are dysbiotic. So the patient has slight dysbiosis there. And then same thing with diversity. Diversity is moderate there at 3. So you can really show the patient here, you have lower of specific phyla, you have dysbiosis, moderate, and diversity is moderate. So this is a great place to start. Now let's take a look at more detailed information. All right, so for this patient, we're going to look specifically at the Firmicutes because remember what we talked about, the fecal bacterium praenicii, when it's low, is associated with major depressive disorder. And we see that here for the patient, right? We also know that the patient's going to be at risk of lower of inflammation just because this bacterium is so anti-inflammatory. And then we note there the Bacterium serum is a little bit lower. That is potentially associated with excess fats and protein along with the standard American diet. So this would be a patient to really do a diet diary. And we do want to support these butyrate producing bacteria like the fecal bacterium. And this bacterium loves soluble fiber. So we want to introduce soluble fiber to feed this bacterium, support the microbiome really. So it's going to be these red kidney beans, lima beans, chickpeas, through some artichokes, garlics, onions, bananas. And we really want to have a high amount. we really want to get to this 8 to 15 grams of soluble fiber per day to support these butyrate producers. Interestingly enough, the American diet is, I think it's average about 3 grams of soluble fiber. So 10 grams of fiber total, generally speaking, 2/3 is insoluble and 1/3 is soluble. So it's about 3 grams. So the patient's nowhere near that. So we want to get to that 8 to 15 to really support these butyrate producing bacteria. Okay. All right. And then here we see for the patient, these inflammatory bacteria, the proteobacteria and the Escherichia species are elevated. So what this really implies is that there is some inflammation in the colon. And we do know that the microbiome plays a role with regards to mental status. There is potentially an inflammatory component there. So we want to help this patient. We want to say, let's add soluble fiber. Let's move away from these inflammatory bacteria. That's great you made this change, with the switching from the less processed diet, but let's continue on that. And let's see where we can tweak it. And then you could add your own anti-inflammatory protocol as well. So people are doing a variety of things from fish oil to turmeric, things like that to help with the colon. But so you can really see here in this case that the test does go along with the patient's presentation. There are some things that we can do to help this individual, especially a motivated individual who's already made some lifestyle changes. This is a great start here. All right, so let's move on to our second case here. We're going to switch gears, a little bit of a different presentation. This is a 26-year-old female, and so she's pretty young here. Unfortunately, she's been dealing her whole life with digestive issues. And I think you might recognize this in your office, that this patient walks in quite frequently with a history of abdominal pain, gas, bloating, constipation to no end, and no diagnosis or no relief. So you're really at a great point here to help this individual. This individual suspects intestinal permeability. Intestinal permeability is kind of becoming more well-known. Patients are getting actually more and more educated, I've noticed, even with regards to gut health. So the patient suspects intestinal permeability but doesn't have a diagnosis. Okay. Now, let's take a look at her report here. Recall, the web is a representation of abundance and diversity superimposed on the normal biotic reference range, which is that green hexagon there. So we see lower actinobacteria, we see lower vermimicroba. With the actinobacteria being lower, I think about vegetables, just broadly speaking, because that phylum does like to consume vegetables. We'll get more detailed information, but that's just kind of the first thing that I think about. Higher bacteroidetes and firmicutes. So we're seeing some disruptions here. The dysbiosis index score is 3, diversity score is 3, so we're really moderate. Okay. All right, so let's take a look at the functional guilds. The great thing about GI 360 is it's a wealth of information, but actually it's all organized with these 5 functional guilds. So the key findings represents the 5 functional guilds in the first column, and then the second column will present the additional findings on the report. So if there's any cultured bacteria, yeast, viruses, inflammatory markers, short-chain fatty acid imbalances, that will all be reported in the second column here. So here we see the butyrate producing bacteria are out of range. So we want to support them with the soluble fiber approach, the fiber feeding approach, the gut barrier protective bacteria out of range, and the gut intestinal health bacteria are lower as well. Inflammatory bacteria are okay, but the gut barrier protective versus the opportunistic bacteria. So here we're already thinking about mucosal barrier integrity, inflammation. So we want to support the butyrate producing bacteria. We want to support those barrier protective bacteria. Again, you can do your own protocol, glutamine, things like that, supporting with soluble fiber to support the butyrate producing bacteria. So then the next thing we're going to look at the second column, we do have a diagnosis of detection of C. difficile. This is highly sensitive and specific, so it does make a difference with regards to the patient's presentation. We do see carbohydrates, and interestingly enough, carbohydrates may be a sign of intestinal permeability in the small intestine, and this might implicate the colon as well. We have low fecal secretory IgA, so there's low immune function. In this case, we want to think about vitamin A, vitamin D, and zinc, as those are the precursors. And we do have 2 high beta glucuronidase, so we want to address that with the soluble fiber, adding vegetables and things like that. Okay. So we take a look at this patient's Firmicutes phylum. Again, we have the low fecal bacterium Proteinitzia, if you can see that here. That's going to be associated with issues with butyrate and inflammation, okay? And then for the patient, I would just note the Ruminococcus navis species associated with mucosal barrier integrity. We already have that information on the first page, but here are the details. As note, we do have this C. difficile. The PCR portion of this test, the pathogens, is highly sensitive and specific. So you want to see if this is a current infection or potentially the patient's an asymptomatic carrier, or this is DNA that is remaining from a resolved infection. In this case, it was DNA remaining from a resolved infection. Okay. And then the stool chemistries page, there's a wealth of information on here. Again, we're talking about elastase. Remember, we talked about eating hygiene, fat stain, carbohydrates. So we do have a clue here about intestinal permeability. We have low immune function and high beta glucuronidase. So things that we can definitely address and help this patient, adding the soluble fiber, polyphenols, things like that, supporting IgA, all this is going to give the patient some relief. And then our last case, I'm just going to briefly present this because with your patient that presents with obesity, this patient is a 50-year-old female. She presents with obesity, fatigue, weight gain. We definitely want to think about the microbiome, but we also want to think about the systems as a whole. So the hormones and the cortisol are very important for this patient. So in this patient that presents with the chronic condition of obesity, we took a look at the hormone metabolite profile, and we noticed she has elevated estrone, and specifically we're going to talk about today is the cortisol and the cortisone. So the patient is stressed, and remember that obesity, stress, microbiome, all of these things are together. And if you take a look here at her 4-point cortisol, we can see with the cortisol awakening response here, the patient does have excess cortisol all throughout. So from waking, 2 hours post-waking, dinner time, and bedtime. So this is a great profile to run alongside the microbiome with your patients, especially your patients that present with obesity, chronic conditions, and things like that. So again, here we see the graph here with the cortisol. So this would be really, in this patient, you want to treat this in addition to the microbiome. So you really want to address these things together. So you want to do your cortisol adrenal consideration, and then you also want to address the microbiome. So that's really, we're at a great advantage in that we can provide these testings and considerations for our patients. All right, and again, stress and cortisol play a role in regards to the microbiome, and this may be associated with dysbiosis. Abdominal obesity may be associated with elevated cortisol. That's a nuanced thing. Inter-individual differences do play a role, but it is a consideration. Okay, and just as a quick Cliff Notes versions for GI health, we're talking about prebiotics, right? We said 8 to 15 grams of soluble fiber per day. Always fermented foods. Fermented foods are associated with increased diversity. So important. Polyphenols are really important. The bacterium love those. Grapeseed, green tea, red berries, things like that. Plenty of water, mineral-rich foods. In that case with the patient of lifelong constipation, that's going to play a role as well. And then we're thinking about those adjunctive considerations, olive oil, fish oil, things like that. All right. So take-home thoughts. Lifestyle contributes to chronic disease. The gut microbiome and chronic disease are intricately connected. Abundance and diversity does play a significant role. Test the microbiome, address those findings, and you can certainly consider utilizing the gut microbiome as the foundation for health. Thank you. Questions?